Namaskar. My name is Dr. Barun Kumar and I'm a consultant urologist and head of cancer unit at Institute of Urology and Kidney Diseases, Guwahati. Today we will be talking about a very important issue, that is prostate cancer. Prostate cancer is one of the most common cancers in men and also one of the serious causes of cancer related mortality among men. So first we have to understand what is prostate gland. Prostate gland is a walnut-shaped gland which is situated just below the bladder and it encircles the male urethra. In the early age group, it doesn't cause much of a symptom except for sometimes it causes infected-related complications which are known as prostatitis. But in male above the age of 45 and 50, it causes a myriad of symptoms which are known as lower urinary tract symptoms. They might be related to your voiding pattern, as in it might take a time while to start urination. You might to have put pressure to pass urine. There might be a little bit of urgency. There intermittency of stream. When you come from the bathroom, there might be a little bit of dribbling of urination, and you might have to wake up again and again in the night. So these are symptoms related with the benign enlargement. But sometimes we do see malignant or cancer related enlargement in which most of the times the symptoms are not so different. In severe cases, we do see some bleeding, as in blood in your urine, which is called as hematuria. There's sometimes complications related to the retention of urine, as your urine might stop as well. And in very advanced cases, we see bony changes which are due to metastasis, in which your cancer has already spread from the organ and it creates bony pain because the cancer is dissolving the bones. So we got to know about the disease and some of the symptoms, but how do you get to know whether you are at risk factor or whether you can have it? So what are the risk factors, or what are the things which can cause prostate cancer? So there is a hereditary and genetic component to it, that if you have a family history, a positive family history of cancer, and especially prostate cancer in your family side, then you might be at risk for it. Second most common risk in our population is metabolic syndrome, as in related to obesity. If you are obese, overweight, then you might be at risk for prostate cancer as well. Then the third most important cause is smoking. Tobacco consumption increases the chance of prostate cancer. If you have symptoms which are related to your prostate problem, which I already discussed before, you might get a screening done which will let you know whether you have a prostate cancer or not. In this, we have two very important tools. The first one is examination by your urologist, which include a digital rectal examination, and the second one is a blood test called prostate specific antigen, or PSA. It will screen the population whether you have a risk for prostate cancer or not. In case your results are coming suspicious, there are certain imaging studies including MRI, bone scan, PSMA PETs, which will let us know about the stage of the disease. Depending on the stage of the disease, we have different treatment modalities which can be offered to the patient. In the early disease, when it is diagnosed early, there is a chance of 100% cure with just surgery, with no need of adjuvant therapies. This is called radical prostatectomy. These days, what we offer is, especially at our institute, at Institute of Urology and Kidney Diseases, is robotic radical prostatectomies, in which we use a surgical robot to completely remove the prostate and all the cancer cells and make your urine continent again. If you have a little bit of advanced cancer, in that case, we might have to use a little bit of hormonal therapy in conjunction with radiotherapy. There are certain chemotherapeutic agents also which are used depending on the stage of cancer you have. There is a good news and there is a bad news. The good news is it is fairly common, and many men in the age group of more than 60 years might actually have it. It's not so rare. But the good news is it's indolent, as in it's very slow growing. So we have plenty of time to diagnose it at an early stage and cure it. And in most of the cases, it is not so severe and it's not so life threatening. So, the key takeaways which I want you to take today is know the organ and the disease. No prostate cancer, no prostate. Number two, I want you to know the symptoms, what you have. It might be related to you having difficulty in passing urine, having too much frequency of urine, having blood in urine, and have other symptoms as well. The third, I want you to know how to get it checked. By going to a urologist, you get this PSA test done, and get examined by your urologist, and depending on that, you might be offered some other test as well. And number four, I want you to know the treatment modalities which are available, including robotic radical prostatectomy and other modalities. The good news is it's curable, it's treatable, and there is no loss of hope. Thank you.